Almost a year to the day since the first COVID-19 vaccine was given in the UK, and still there's a steady flow of people at vaccination centres like this one. 1 million people have booked their booster this week, keen to protect themselves in the face of a new variant. There are still many unknowns with the Omicron variant, but it's thought to be more transmissible.
We should continue as much as we can to live as a society in the way we want to live, and until they've got some, either definite proof that this vaccine isn't effective, and at that point we'll all get locked up again, but hopefully that's not the case.
I think it's more restriction should be, the government should do more because to stop this virus and everything, because I think no one follow the rules, the restriction anymore. You go in a bus now, it's just, it's like wild.
There was already a huge push to get jabs in arms before the discovery of the Omicron variant, but now that campaign has really ramped up. NHS bosses have now told GP surgeries in England that they can defer services to free up capacity to give more boosters. Since it was first reported in South Africa 11 days ago, Omicron has now spread across the world, from Saudi Arabia to India and South Korea. It's appeared in the US, including at a conference in New York, attended by 53,000 people. There are cases across Europe. At least 130 have been detected in the UK, and a mass outbreak in Norway. 120 people went to a corporate Christmas party at a restaurant in Oslo last week. All were fully vaccinated and had tested negative before going, but it's thought at least half caught the Omicron variant, supporting concerns about how quickly it can spread. While getting her booster earlier, Nicola Sturgeon tried to allay fears that the vaccines might be less effective against the variant.
It's really important to stress that even if that was the case, less effective does not mean ineffective. You're still going to have so much more protection.
Today, the UK government has released this video to encourage expectant women to get vaccinated.
So I was about 32 to 33 weeks pregnant at that stage when we both got COVID. Following the birth of my son, he was taken straight to ICU in Burnley, and I continued to deteriorate.
The Department of Health says nearly 1 in 5 COVID-19 patients who are most critically ill are pregnant women who have not been vaccinated. Until more is known about Omicron, preparations for Christmas are full steam ahead. Everyone waiting with bated breath, desperately hoping that this variant is less threatening than the last.
Well, with more on the spread of the Omicron variant, which was first identified in South Africa, I'm joined by Mia Malan, Editor-in-Chief of the Bekesisa Centre for Health Journalism, based in Johannesburg. So could you identify some of the most interesting data that's emerging? Perhaps we should start with reinfections, people getting the new variant after having had the old one.
So we've had a study, it's one of the first studies that's been published on the Omicron variant that was released last week here in South Africa, that showed that the scientists compared the risk of reinfection by the Omicron variant compared to the Beta and Delta variants, which is the variants that dominated our previous waves. And they found that if someone has already had COVID and they get exposed to the SARS-CoV-2 virus again, then if that virus is the Omicron variant, your risk is 3 times higher to get reinfected compared to the Beta and Delta variant.
Right, but the crucial difference perhaps between South Africa and the UK is that, a huge proportion of the UK is vaccinated. So what difference does that make to those numbers?
Yes, that's correct. Now, so this study that I'm talking about didn't measure it for vaccination. It was specifically for natural infection. But what I can say is that the indication that it gives us, those results tell us that if it's a higher risk to get reinfected by the Omicron variant, then it's an indication that the Omicron variant has the ability to get around the protection, so immune escape, that protects us from natural infection against getting infected. So it is 3 times better than the Beta or Delta variant to get around the protection that our antibodies offer us against getting infected with SARS-CoV-2.
Do you know what proportion now of South African cases are the new variant?
So in Gauteng, the province where the Omicron variant outbreak started, it's dominant in the province and it's rapidly spreading to other countries. To give you an idea of how dominant it is in Gauteng or how fast it's spreading, in our country, about a quarter of the tests that we have come out positive now, and we've seen a 14-fold increase. Now, the interesting things that we're seeing is a hospital in the middle of the district where this outbreak started. They released results today of the first 2 weeks of their outbreak. And what they found was that there are shorter stays for patients, considerably shorter than with other variants. They also found that a much smaller proportion of patients require oxygen and that there's a lower death rate. But we have to remember that this is only the first 2 weeks of the outbreak, and people take time to fall ill and to die. So we could still see a different patient profile. But the other interesting thing that we're seeing across the country is that patients are younger who are getting admitted. And specifically between the ages of 0 and 5, we are seeing a significant increase of hospital admissions. But important to point out, this hospital who released their results tonight, 3/4 of their patients didn't end up in hospital because of COVID. They went there for another condition and then got tested before they got admitted and then heard they had COVID. So they didn't have significant symptoms before getting admitted.
Now, again, to try and make that data, more relevant, if you like, for a British audience, I think people here are really worried about the older age profile. Is there significant data on older age groups coming from South Africa yet?
So we are still seeing the most admissions are in the older age group of people of 60 and older, although the proportion of younger people have increased, but we are still seeing the most admissions in older people. And we're also seeing that the people who are getting admitted are almost always unvaccinated. And when they start to get admitted to stay in ICU, that proportion of unvaccinated increases even more. So even though in my country we've only vaccinated about 1/3 of adults, we're still seeing that vaccinated people very, very rarely get admitted to hospital with this new variant.
Mia Malan, thank you very much indeed. Well, joining me now from Cambridge is Professor Ravi Gupta, a clinical microbiologist who sits on the government's Nerve Tag Committee, which advises on the threats posed by COVID and other viruses. Is it still too soon to draw any conclusions about how dangerous this variant is?
Hi, so I'll be speaking in a personal capacity, and I think that you're right, that it is a little bit early to be drawing conclusions. I think we've just heard a really interesting description of the clinical case burden in South Africa. And of course, the sort of characteristics of the population are quite different to the United Kingdom. So we do need to wait, obviously be prepared as we have been, but also wait for the data to come through from the UK or other similar countries in order to ascertain just how much of a problem this virus is for people who are vaccinated.
Now, one of the most eye-catching things that has happened is this Christmas party in Norway, a corporate Christmas party, 120 people, all said to be double vaccinated and who did tests before going to the party. But they're now saying 100 out of 120 of those people have got coronavirus, and it's expected to be the new variant that they've got. I mean, can you draw anything from a single party?
It is difficult because, of course, we know about super spreader events, and these things do happen. We know that Delta, for example, was able to cause infection despite vaccination. This is quite extraordinary, though. I mean, that's a very high attack rate, as it were, or a breakthrough rate. And it is rather extraordinary, but we don't know who the index case was, and maybe they were somebody with extremely high viral load, a degree of immune suppression. We don't really know. But if we saw multiple episodes of this or other examples, then I think we could start saying that this is actually a virus that is highly transmissible, potentially because of partial immune evasion.
And if that is the case, will we need to take new measures or further measures in Britain?
I think that is a very difficult thing. I mean, we are trying to, of course, optimize boosters because, of course, increasing levels of immune cells and antibodies after the second dose is essential. We know that they start declining after 2 months post your second dose. So, many people are way beyond that and they do need boosting. And that may in itself help to prevent a breakthrough infection. in contrast to what we saw in Norway, as we heard. So I think that the vaccination is essential. I think that the mask mandates are important. We probably do need to extend them, and we probably do need to ask people to work from home, in my opinion, given that we're heading towards the festive season with a lot of mixing. There does need to be some guidance, I think, probably around mixing, if we're going to sort of stave off any expansion of cases.
Yeah, I mean, it appears at the moment the government is sort of leaving this to individuals and companies to sort of decide. But your advice then is to start returning to the kinds of measures of working from home and social distancing that we saw before, is it?
Well, I think it's an option that needs to be seriously considered in light of the emerging data, and I think that this is the issue. It is really a real-time decision-making process, and the outcome may change depending on what the data are at the time you make the decision. So these are very difficult situations to be in.
Will you be going to any Christmas parties?
Well, my own medical one in the hospital has been sort of postponed in that we are the infectious disease team. So people, we're a bit worried that that team may end up coming down with coronavirus, which would not be popular.
So that'll be a no. And what about travel restrictions? Some people have been suggesting they need to get tighter. Do you think we need more travel restrictions?
Travel restrictions, I think, at this stage are probably not going to be effective. We've seen that despite the fact that the UK closed flights, we still have ended up with a significant number of imports. But I think that tighter testing on arrival is essential, and testing on departure could be tightened up to allow travel to occur. But because I think that the economic damage is quite significant from travel restrictions.
Professor Ravi Gupta, thank you very much indeed.